Hi everyone. Today we are thrilled to be here with Dr. Viana, who located in Italy but did work with 4 different countries' medical centers. And this is a series of editors speak with journal Cephalalgia. This topic is migraine aura and visual migraine aura iconography. So please, Dr. Viana, tell us a little bit about yourself.
Okay, good morning, everybody. I am a neurologist. I work especially in the clinical field, and I really love and I'm very interested into the topic of migraine aura. You know why? Because searching in the literature and the studying this topic, I unfortunately I seen that there was so poor, so very scarce, very few number of studies in clinical, the clinical aspect of migraine aura. Although we have hundreds, thousands of studies with respect to the preclinical side, but I really think that the clinical aspects are very, very important for many reasons. Because migraine aura, it's a lot to uh, to be narrated. It's a very huge topic with hundreds of scenarios. It's very polyhedric, and so what I wanted to do was be sure of its clinical presentation and to have really to put some really milestones also in the clinical side, in the clinical narration, not just for me, but for all the researchers, all the medical doctors of the world, because we must think that the prevalence of migraine aura is estimated in about 8% of the general population, so it's a very common disturbance, really. And as I told you, we can have hundreds of scenarios. And I will tell you why, and also how I studied these scenarios, and the ways in which I arrived at the minimal bricks of this great wall, this great composition, mosaic that is the migraine aura. So first of all, I started with a systematic review of the literature, which was published in 2019. So I studied I searching in the literature, focusing my attention with all the clinical studies that were done and about the clinical manifestation of the migraine aura, especially in the visual migraine aura. And I after that I have seen that there was what I called these elementary visual symptoms, which after that I created a list. What are elementary visual symptoms? They are the simplest degree of visual aura that cannot be divided further into sub-symptoms. For example, scotoma, bright dots, zigzag line, hemianopsia. These are what I call elementary visual symptoms. And you can find them in some auras alone, just one of them, or they can be combined. They can appear simultaneously, okay? So we have, for example, a scotoma with bright dots, a scotoma with zigzag line, a scotoma with zigzag line and a hemianopsia, so they can be together, okay? And these create hundreds of scenarios. And so this gave me the possibility to start with the simplest level of the clinical manifestation of migraine auras. So after having created such list and published it, I say, okay, now we have this list, which is very important. So we know what can be a clinical manifestation of migraine, of visual migraine aura, but we need something more. We need that this list can be translated into visual images. Why? Because it's very difficult to inquire verbally about these symptoms. It's very difficult. It takes a long time for the medical doctor, and if they are not inquired properly, you can lose symptoms, you can lose the history of these symptoms, and also and at the end of the day, you lose the diagnosis of migraine aura, which is very important to be done. Consider also the stratification of the cardiovascular risk factor. Consider the possibility or not to prescribe estroprogestinic pills, many different aspects. Or consider also that maybe you want to treat also this medical condition, which for many patients is very scaring, It's very difficult to handle. So in these studies, what we have done was creating what I call standardized migraine aura iconography. Okay, what is this standardized migraine aura iconography, which the acronym is SMAI? Is a set of images representing each one an elementary visual symptoms, as I told you, like scotoma, the zigzag lines, and these visual disturbances was created by the same person with the same software and on the same background images. So this is standardization. And this was very important for me because we wanted that the patient looking, viewing this set of images was just focused on the visual or visual disturbances without any confounding factors, okay? So in the study, we created also these images with also with the help of the literature, with the help of the picture created by patient themselves and put on the web. So we created this set of 25 images, and we tested on a very large population of migraine with aura patients. And indeed, I designed the studies and conducted in 4 huge headache centers all over Europe that were in Copenhagen, Denmark, in Trondheim, Norway, Lugano, Switzerland, and Pozzilli in Italy. With let me say that these centers were in these centers there were very, very good researchers, expert in migraine field and in general, and very interested as me into the aura field. And so finally we started with the studies, and how we tested these images on this very large population of migraine with aura patients. We created a web survey. Okay, of course, in every languages for the different populations, but there was the same survey where patients could see all the different images and say, okay, it's part of my aura or not. And the very good thing that we done also was making questions also with text, with a written text describing the visual symptoms, in case they say, okay, this image was not part of my aura, because we thought that maybe we didn't so good into creating the images. So if the patient saw a scotoma, say, no, it's not part of my aura, the scotoma images, right after we ask, have you ever seen any blind spots in your visual field during a migraine aura? So if he or she said yes, also we ask him or her to explain what was the differences in the images of his perception with respect to our images. This also this was done with the idea that finally we did after that, of creating a 2.0 version of our standardized migraine aura iconography, a new set of images, okay? Because we hypothesized that maybe our images were not the best in the world, and so we wanted to ameliorate in a second phase of the study with the feedback from patients. So this was the survey with the patient was shown with all the element, with the 25 images of each elementary visual symptoms of aura. As I told you, in case the response was negative, they underwent also two text questions about the same disturbances. And at the end of the survey, to be sure that we didn't lose anything, we asked if the patient had other visual disturbances that were not mentioned, neither with the images or with the text, in his life, in his experience. So I think that with this design, we covered almost all the visual aura experiences of the patient all over their lives. So this was the design, and this was the phase also of the survey. And then we then after that analyzed this huge data, because finally 215 patients completed this study.
That's a lot of great work. How many from those patients could identify that they see during the aura representation on this iconography?
How the question is, how can they be sure about that was aura and not other thing?
Actually, in article, my understanding that only very small percent of these participants did not identify image. Is it correct? Like
Really?
majority?
Really?
Yeah.
Really? Really? No, sorry, no, because
Yeah.
there are a lot of aspects to consider. No,
Mhm.
really, yeah. Jumping to results, I was also very impressed, really
Yes.
impressed by result, because nearly 80% of the
Wow.
all possible elementary visual symptoms, that was more than 1,000 that we collected, more than 1,000 recognized or via the images or via the text, but the 80% of them were recognized just with images. So I
Amazing.
was very happy, because I say, okay, we did a very good job just
Yes.
with the first phase. I mean, with the review of the literature, but also in depicting, in creating these images. But but the incredible thing, because I had another analysis, another result that was very important, is that more than 98% of patients recognized at least one of our images as part of their migraine aura.
Outstanding.
So I mean, then of course we need a lot of further studies to evaluate this tool, this May, but I mean, using just this unique tool to say, okay, showing to patient all this set of images, if they see something as part of the area, you just lose 2% of them that they didn't recognize any images. So it's a lot. It's a lot, really. And yes, we were very happy, but we didn't stop just like that. We didn't. We were not enough happy just with that, but we wanted, as I told you before, ameliorate this set of images with a 2.0 version, with a second version of SMAIL, when we added a new elementary visual symptom, because finally we found just one elementary visual symptom in one patient that was not inserted among the other 25. And this was what I call the Courtine's phenomena, because patient describe something like a tunnel vision, okay, but the dark part was just on the sides, like the curtains of a theater. So we added also this an image of this one. We ameliorated some other images with the patient feedback, but also with the colors. Because I didn't tell you before, but also when patient recognize or identify one elementary visual symptom with the image or the text, is not important. After that, for some of them, in particular the positive ones, like zigzag lines or the bright dots, we ask for which color was among a list of 14 colors. And also we ask about the flickering, because this is another particular aspect of auras that sometimes in a wrong way is this is a feature, okay, that can be of almost all kind of elementary visual symptoms, but sometimes this feature is identified just it was a specific symptom. No, it's a feature of most of the elementary visual symptom. And also this is very important to be detailed on this aspect, you know, because the details are very fundamental you know, in most aspects of our life, of our work, of our research, but it's of utmost importance in the clinical aspect of migraine aura. If there is something that I learned in this field, is that the particulars, the details are really, really important, because they can make the difference, okay? So also, finally, we ask also during the survey about the colors, and we put the colors they choose in the new images, okay? If, for example, the elementary visual symptoms was the, I don't know, the colored lines, we colored them with the all different colors they choose in the survey. So finally, we created this 2.0, this new version of the standardized migraine aura iconography, that I was very happy that the educational committee of IHS decided to upload in the website of IHS, and all of you, dear colleagues, can download. You can download in A4 or also A3 size, print it out, put on the wall of your headache center or on the desk, and just show to patient in the daily clinical practice. and this can be very helpful to start into digging into the visual or history. As a screening tool, of course. You can start as a screening tool, then you can go deeper and, for example, monitoring during over different visit with patient if there's something changed. This tool can be, I think, speaking about the possibilities, can be really important for epidemiology studies, because there is not just any one epidemiological study in migraine aura, and because it was very almost impossible go on the population, explain, asking about, inquiring about aura. But now this tool can help a lot with these particular kinds of studies. Okay, that of course I don't want to give the message that with this tool you do the diagnosis. No, this is like in this kind of setting can be like a screening tool, and then you can start, as I told you, digging into it, phenotyping very well, but also it's visual, and all the visual disturbances are in the same table. It's very good for starting as a screening tool in this setting. But it's really, really useful also for phenotyping, deep phenotyping in clinical research, because thanks to that, you can divide patients with very, very mild differences. You can put patient just on a side, on a branch, just like with scotoma, and other with the scotoma plus zigzag lines, okay? And you can do in a very simple way, but going very deep in phenotyping. And this is very important for stratifying patients, for having a homogeneous group of patients. You can think, if you want to compare patient with a certain phenotype of migraine aura, for example, functional neuroimaging, and you want to compare two groups, you want that these groups are very homogeneous to get the real difference without having any noise. So this tool can be very helpful also in this kind of studies. So I'm very happy, and coming back, as I said, in the clinical practice, it can be also put in the general practitioner clinic, or also in the gynecologist. They won't do the diagnosis with that, but they can, for example, show it that to patient. They can start to think, yeah, maybe this patient that see this table and identified some visual disturbances. This is a patient that need to have a neurological headache center consultation to be sure that there is or not, to confirm or not a diagnosis of migraine aura, because they cannot prescribe, for example, estroprogestinic pills. So this is very useful in different settings, and I'm very happy about that, really, because and now that is on the IHS website, really, for me, is an honor, and I think it's the best way to disseminate this tool.
That's fantastic. And I believe you mentioned that it's on Learning Center at
Sorry. Yeah.
International Headache
Really.
Society part of
Sure.
website,
Yes.
and we can download it
Yes.
and use it from screening in the clinic to
Yes.
intense research
Yes. Yes.
on
Right.
migraine, which is spectacular. For you personally, where do you see next step in research?
There are hundreds of scenarios of next step here,
Yes.
because as I told you, you can use it in very different setting and for different purposes. But what I'm working on now is an aura application for the mobile phones.
Wow.
And this is a huge project that I started working on with the friends and colleague of NTNU in Norway, Trondheim. The big boss is Erling Tromvik, and it's a very really good researcher and also good friend. And we created this app that is almost ready to be released. And for example, this tool help us when we want to ask patient what they see during the aura. So they can just scroll on the screen the different types of visual aura disturbances, and they can choose what they are seeing in that particular moment. Also, they can, with this aura app, for example, they can draw with the finger in which part of the visual field they have this particular visual disturbance. And indeed, if they have more than one, they can add more than one, because as I told you, look, coming back to my study, the median number of elementary visual symptoms that each patient had in my study, this last one, was 7, which is high number, okay? But as I told you, these disturbances can also come together or in different moments of the same aura. It's like sometimes they can appear in over different auras, because as I already demonstrated in other studies, that just 40–50% of patients has stereotype auras, meaning that this always the same phenotype, the same presentation. All the other one have different auras, even in the same period of their life, not just over different years, but also in the same year. For example, in the same year, they can present different phenotype scenarios of auras. So yeah, but I'm very so this is one, of course, coming back to your last question, this is one of the application of this tool, and I think that mobile devices should be used, because we wear them, we have always with us, and they can be very important for the recording and for phenotyping, because everything we give to them, to this application, can be used. So the standardized microneural iconography was put also in this app, and we were very happy about that, because we jump from the study to the real world investigation.
This is fantastic. Thank
Yeah.
you so much for sharing that. Congratulations on your wonderful research, and we cannot wait to hear more about your new results and new research, and it will help us in our clinic
Yeah.
and in new progress in studying migraine. Thank you so much, and we will see everyone soon.
Thank
Thank
you. It
you.
was a pleasure to be with you. Thank you. See you.
Thank you.